Hello, everybody. My name is Rebecca Remsen. I'm going to kick off this webinar with all of you today. Thank you, everybody, for joining. At any time, feel free to use the chat to ask questions, and you can chat us directly or chat the whole group. I understand that Tucker sent an email to all of you earlier today, so we hope that this is an open discussion and you feel comfortable asking the group anything that you have. We are joined today by senior service providers from around the country, from North Carolina, Missouri, Kentucky, Virginia, and other states. This shows us that this is a common challenge for all of us and a common concern for all of us as we enter into this new reality as we are beginning to serve our seniors face-to-face for the first time. We know we are going to expect to see a decline with the seniors we serve. The questions we have and that we hope to address in this webinar today is what decline should we be expecting? How can we understand and assess that decline? And what can we be doing to can we be doing to help our seniors and the seniors we serve and support and love stay independent for as long as possible. So today I'm joined by Dr. Jordan Golin, Stefanie Small, and Tucker Feltz. Dave, could you please open up the slide so that people can see their names? So Jordan Golin is the president and CEO of Jewish Family and Community Services of Pittsburgh. Dr. Golin has been with JFCS for over 20 years, having served as director of clinical services and COO of the agency. Dr. Golin was instrumental in creating Age Well Pittsburgh, which is a 3-agency award-winning partnership dedicated to the well-being of seniors. Dr. Golin has also guided the development of the PFMIpro, an outcome measurement app utilized by organizations throughout the country for maintaining the independence of seniors. Stefanie Small, who is our other presenter, is the Director of Clinical Services at JFCS here in Pittsburgh. She has been with the agency for over 20 years as well. And as Director of Clinical Services, she is responsible for all programs in counseling and senior services. She manages that Age Well Pittsburgh collaboration that Jordan was the founder of, and worked with various community agencies, including the United Way, Age Friendly Pittsburgh, and the Jewish Federation of Greater Pittsburgh. She speaks to the community about how to talk with loved ones about aging, older adult depression, other educational topics related to aging. And we are also joined by Tucker Feltz, who has been in touch over the past few days. He is the PFMIpro Business Development Representative, and over the past 20 years, he's helped organizations and companies streamline their businesses, increase revenue, and help clients live better lives. As a lead with PFMIpro, he is helping providers assess seniors and help their senior population stay independent. He'll be in touch after the call to help you on an individual level. With that, I will allow Jordan and Stefanie to take it from here. If at any time you have any questions, just hop onto chat, raise your hand, or unmute yourself and just interrupt. We'll see how that goes.
Great, thanks, Rebecca. So we're actually going to get started with a poll. And I guess actually even before we throw the poll up there, I do want to just mention something that Rebecca pointed out, which is the PFMIpro. This is not a PFMIpro is an outcome measurement tool. That's not the purpose of this webinar today. This is not an infomercial for the PFMIpro, but we will be referring to the PFMIpro for a few reasons, and we'll mention that as we go along. But I just want to make sure everyone understands what that is, so that when you hear it, you'll be clued in. We are going to start with a poll because we want to hear from you, the kinds of changes that you are most concerned about when you begin working face-to-face with your older adult clients again. So if you can select the changes that are most concerning to you, you can select, I believe you can select more than one of these. And we'll give you just a moment to do that and then to submit. And Dave, if you can let us know when you see the results of that poll.
Yep, I'll leave it up for about 20 more seconds. Okay.
And here are the results. So it looks like all four of these domains are areas that you all are concerned about, primarily though, the psychological domain and the safety and security domain. That's helpful for us to know because we will emphasize those two domains most as we go through this presentation today. So why did we choose these four domains for our poll? Well, there's a reason for it. These four domains have factors associated with them. You can call them risk factors or protective factors, depending on your strength-based or pathology-based approach to older adults. But these domains all contain factors that are associated with a loss of independence among seniors. There's a lot of research out there in the professional literature about these domains, and so the PFMIpro, our outcome measurement tool, is built on that research base. And we find these four domains especially useful when doing assessments to help guide them. Because as you all know, when you assess older adults in their homes, there are a million and one things you can be looking for and asking about and paying attention to. There needs to be some way of organizing your assessments, especially after a significant worldwide pandemic, when you're trying to really focus in on the most important, the most critical things. So we're going to go through the assessment process using these four domains as a guide. And again, it doesn't mean you have to use the PFMIpro when you're doing assessments, but we do feel like this is a useful framework for doing, for thinking about seniors. So the first domain is the physical domain. So the physical domain includes things like age, something that we obviously have no ability to control, but something that's very relevant for our older adult clients. And again, with professional literature, is highly correlated with a loss of independence. Activities of daily living and instrumental activities of daily living, how our clients are able to take care of their daily tasks or the struggles that they're experiencing now, perhaps more than prior to COVID. Adequate nutrition, making sure that our clients are getting enough meals each day, getting enough into their bodies, and paying attention to how that may have been happening differently since COVID imposed restrictions on their movement. Exercise and physical activity, how sedentary our clients have become as a result of decreased ability to get around, to get outside safely. Medical coverage is really focusing on insurance. Have insurance products lapsed? Are they still covered with adequate health insurance? And then medication compliance, of course, taking medication as prescribed by their physicians and identifying any changes in their medication practices since COVID began. What I'm going to do now is I'm going to turn over to Stefanie to talk more specifically about the physical domain and doing an assessment of seniors post-COVID or whatever post-COVID means with these things in mind. Stefanie?
Thanks, Jordan. So as Jordan mentioned, age is one of those things we can't change as much as we might like to. But even though it can't be changed, we do know that depending on how old our older adult is, that can be affecting other things. So the older your older adult is, right, if they're 85 and older, they're already higher at risk from many things. So people who might have been alone or with fewer people surrounding them at that age, it's a risk factor that you have to really take a closer look at. It's easy enough to assess. We ask them how old they are, right? But their biological age, their physical age, their chronological age all differ. Take a closer look at those who are older than the younger adults. ADLs and IADLs. For the most part, people probably had to continue doing whatever they were doing before the pandemic, but now that they're coming out of it, they may have more help in the house, Or they may have thought, well, I didn't have help in the house over the course of the year, I'm fine. But we also know they really might not be fine. And to take a closer look at especially the IADLs, they're paying their bills, they're doing their laundry, their meal preparation. We can easily tell if somebody can take a shower by themselves or not, or can use the bathroom by themselves or not. But they may be saying, oh yeah, I can do my laundry. But if you take a closer look while you're visiting with them and you realize, that shirt looks stained or that skirt looks stained, there may be more beneath the surface. So you may have to dig a little deeper than you might ordinarily in normal pre-pandemic times. Adequate nutrition. We know that one of the big issues during the pandemic, at least at the beginning, were, did people have access to food? Many older adults did not know how to use Instacart. They were afraid to go out to the supermarket. So at the beginning, we were very concerned about nutrition. And that may have changed for some people over the course of the year, but maybe not for everyone. People may have decided, well, I'm fine. I can get milk from the corner store and they're safe. So they're eating a lot of cereal and milk, which, while fortified, is not a balanced meal. They may not be able to afford the lettuce and tomatoes that the corner store is selling, but that's what they're able to get. So they're limiting what they're purchasing because of safety purposes. And again, even though many people feel better since the beginning of the pandemic, that may not be the case with everyone. So although you might dismiss it, if they've been living on lean cuisine for a year, you really might want to take a close look at that. Exercise. All right, we've all not done what we're supposed to do over the course of the year for exercise, right? When we were in college, we worried about the freshman 15. Now we've got the COVID 15. Why it's always 15, I don't know, but those are the ones we're always worried about. These are people who really did, as Jordan mentioned, become pretty sedentary. And when the only exercise many of them could do was take a walk, and even then, for some of them, it might not have been safe to do so for a variety of reasons we'll talk about in a few slides from now. Asking them directly is probably the best thing to do, because we know that many older adults, as with all of us, exaggerate what they do to make themselves look better. How many of us have clients who go to the doctor, put on what I like to call the dog and pony show? Oh, I'm fine, doctor, I'm fine. And then they go home and collapse for 2 days. Their stamina is not what it was. Their exercise routines are not what they were. You have to really poke that bear and encourage them to get back into it. Now, many of them might have been going to community centers to exercise and use the classes, and that wasn't available to them. Maybe they had gone online, and a lot of your older adults don't have connectivity. So there may have been things offered, not everyone is able to take advantage of them. Medical coverage, as Jordan mentioned, it's insurance. Most people's insurance didn't change over the course of a year, but always important to check. We did have some, they switched from Medicare to Medigap, whatever it might be. It's an asking question. It's not too difficult. But medication compliance, that's a horse of a different color. Many of our people may have had to turn to filling their own pill boxes where family may have helped them before. Or they may have decided, well, I can't afford to, eat or take that pill, so they stop taking it, or they cut it in half. Are they going to own up to that right away? No. You ask them, have you been taking your pills correctly? They might tell you yes. If you ask them, have you been taking your pills as prescribed by the doctor? They may not be hedging as much. But if you ask them directly, have you had trouble taking your pills this year? Have you changed how you take your pills? Are you afraid to take your pills? These are questions you have to delve deeper, because many of them may have hidden it for lots of different reasons, and they really need to get back into being as compliant as possible. We had a geriatric psychiatrist a number of years ago who said if they can get their patients to take their pills 75% of the time, that's compliant. Let's try to get it back to that.
Great, thanks, Stephanie. We're going to move on to the next domain, and that's the social domain. So the social domain obviously has hit all of us hard during COVID, right? I mean, the thing that people seem to complain the most about is the lack of human interaction, physical contact, social engagement. We all joke about, maybe not even joking about, the decline in our social skills because of the limited social interactions we've been having. Well, for seniors in particular, that's of concern. So the things that fall under the social domain include living with someone, because the research suggests that people who are seniors who are living alone are at higher risk of losing their independence. social involvement, again, any kind of general social interaction with peers and with others. And then there are three caregiver factors that we use in the PFMIpro. Why? Well, the caregiver well-being question is an important question when working with seniors. And by the way, I'm talking here about family caregivers, not paid caregivers. And that's because research suggests that family caregivers who aren't doing well are likely to have older adult loved ones who also are not doing well. So we break this down into three different areas. The first one is health. Health can be a problem with family caregivers who have experienced over the course of the past year physical or psychological challenges. The physical stamina factor has to do with the ability to provide care to the aging loved one and the toll it can take on someone's physical well-being. And then financial security. Is the caregiver, the family caregiver, having financial challenges, him or herself, because that can create additional stress for their older adult loved one. So Stefanie, now we'll have you talk about these factors in the context of visiting with seniors post-pandemic.
Thanks, Jordan. So as you mentioned, living with someone is absolutely a protective factor. We already know the people who live alone don't do as well as someone living with another person. And we hope that many of our people that we care for did have that ability to stay with someone. Many of them didn't. But that may have changed. People who lived alone might have moved in with loved ones during the pandemic and now are going back to living alone. So that in and of itself is a change and must be addressed, because people who didn't live alone for a year and became, even if they wouldn't admit it, somewhat dependent on the people they lived with, they may not be as ready to go back as they are claiming to, right? Maybe their kids are saying, okay, Dad, it's time to go back to your apartment. And Dad is all like, okay, dear, sure. But Dad's really not so sure. Asking the client directly about that, even with either in hearing range of the child or not hearing range of the child, is an important tactic to take. Social involvement. How many of our clients used to go to the community centers, they volunteered, they did all these wonderful things, and then the pandemic shut everything down. And short of maybe having a porch visit while someone stands on the sidewalk and talks to them over the course of a year, it's not the same. And so many of them really went from 60 to 0, and we need to kind of ratchet that back up. But many of those opportunities may not be present yet, or if they are present, our older adults may not be ready to psychologically approach it in that way. But it's an important thing. Social involvement is so key to making sure people age well. And so we want to dig deep to see, well, you're not returning to that volunteering job? Tell me why. Maybe it's because they're afraid of the COVID precautions that are taken. Because again, even though you're vaccinated or they're vaccinated, it doesn't mean they're 100% protected. And so they may still be wary of going back into locations. So asking the questions as to why or why not they're approaching something is a good tactic to take. With caregivers, it's a delicate balance. I have been facilitating a caregiver support group at JFCS for 20 years. And during COVID, we actually went from monthly to twice a month because we realized very quickly these caregivers didn't have anybody to talk to about the things they were dealing with. And they really, really needed each other on a different level. And we've continued it every 2 weeks now for the entire year since last March. And we may continue doing that for a good long while to go for, including a virtual session. Many people are scared of those virtual caregiver groups. Some people haven't found it works. We found it does. So asking those caregivers who really had to take on way more than they ever expected to have to, right? They may have gotten rid of the paid caregivers. So physically, they had much more burden this year than they have in the past. Health, their own emotional health, they were isolated too. They were suffering from the same thing everyone else was, but then had this added burden. So assessing their emotional and physical health and their physical stamina are key. Financially, right? We saw at the beginning, a lot of people actually saved money because they didn't have to pay for paid caregivers. And many of them who may have been thinking about moving into a facility really hesitated when so many COVID rates went up so high in facilities. But on the other hand, if the adult caregiver is not necessarily a spouse, what if it was a child? The child was laid off, or the child had to work remotely and they couldn't do both. Or maybe they were furloughed and are now being called back. So financial security was probably all over the map this year. And asking the caregivers directly, what do you need? what might be able to help? If you're going back to work, do you now need help in the house? How is that going to look for you financially? So these are nuances that we don't always think about when we're talking about caregivers. We often think of spousal caregivers before children, but in this case, especially with financial, the child's financial security is key a lot of the times to the client's health.
Great, thanks, Stephanie. And I just want to mention that you can put questions into the chat. I actually can't see the chat because I'm sharing my screen. So if there are questions, Stephanie, if you can periodically pay attention to it, and we can bring them up. Okay. The third domain is safety and security. And this was one of the big ones that you all were concerned about as reflected in our poll. So what are safety and security factors? What risk factors do the research suggests are highly correlated with the loss of independence we need to be paying attention to? So income, right? That's a no-brainer. Financial stress leads to physical, emotional stress. Safe environment. A safe environment and appropriate housing, these two factors on here can be a little bit confusing at first glance what the difference is between them. So safe environment is really things like, are there hazards in the environment that place the older adult at risk? Things like throw rugs or clutter, those sorts of things. And how has that changed since pre-COVID? Appropriate housing is more like, is the client still, is this housing situation still appropriate for the client? Should they still be living here at all? Is it possible to fix it up, or should they be looking at some sort of alternative housing arrangement? Financial stability, different from income. Financial stability is more about financial management, the ability of seniors to manage their finances, to pay their bills, to stay on top of things the way they need to. And finally, personal safety. And personal safety has to do with judgment. Judgment about walking out in the snow with appropriate clothing. Here in Pittsburgh, last week we had a snowstorm. Today we're getting a high of 70. The weather is changing quickly, and across the country with climate change, it's often difficult to predict what kind of weather we're going to have from one day to the next. Are our clients able to make appropriate decisions to keep themselves safe with regards to the weather, with regards to their living arrangements, and other sorts of things? So Stephanie, tell us how this all relates to doing assessments as things begin to open up.
Absolutely. So I'm going to actually take them in little bunches here. So income and financial stability. Again, even though they're different, they are related. So income, many of the people that you're probably dealing with have been retired. They might be on Social Security, they may be on pensions, and they have the benefits packages that they've had for years. Maybe some of them have been on medical assistance. And then the COVID stimulus payments came in. And as we were reminded earlier today from our guardianship department, many of these people were told that the COVID stimuli would not affect benefits. However, unless you have a good caseworker who's paying attention to the fact that, oh, don't count it against this person, people might be losing benefits and we're not even aware of it. So if you have clients who are on medical assistance, who are on public assistance, who whatever, different states have different things here in Pennsylvania, it's Compass, if there's different packages they may be receiving, and they were told the COVID payments wouldn't affect it, but then someone didn't pay attention and they did, you may have to reapply for them. But they may not even know until the next time they go to the doctor and they find out that their insurance has lapsed. So it's different, it's related to the coverage from before, but it really is an income-based issue. So on the other hand, they get those income, they get this giant stimulus payment, right? They're very excited for it. And what do? They spend it. Now, many of them, which is what the government wanted, right? Let's put that out there. The government wanted us to spend it. But what were they spending it on? Because many people who might have been financially stable, they had their budget, they did what they needed to do. Well, they get this influx of cash. What did they do with it? And now did that kind of trigger other spending things? So if maybe they said, oh, I got $500, I'm going to go spend it online. And then they find, oh, this site has this and this site has this. And suddenly they become very profligate with their spending online. Or maybe they fall for a couple of COVID schemes that have come through recently. or social security schemes. So by being aware of where their spending habits have been before and where they are now, and asking them about that. You might go into their home and see this beautiful new lamp and say, hey, where'd you get that? And they'll talk to you about it because everybody likes to talk about the new things that they have in their home. But asking them directly about it is important because they may not have even thought about how that affects their budget long term or how that affects their income baseline. For safe environment and appropriate housing, it's a similar connection, right? You're looking at how they've been in this house. And maybe before they were looking again, they were maybe looking to move and they couldn't for some reason. And over the course of the year, they realized, oh, I can stay longer in this house. I'm doing well. Or, oh my goodness, I got to get out of here. I can't handle this house on my own. And maybe it's because the house itself is too big, or maybe because there's too many stairs. Here in Pittsburgh, you blink and there's another set of stairs in your house. We have literally streets that have stairs in the middle of the streets. So the hills here are often a reason people move out of their homes. But the throw rugs, are they paying attention to that? Are they looking at the overall environment surrounding where they're living? Crime went down exponentially in 2020, but we're also seeing a very sharp rise in the past couple of months nationally. And so while they may have felt safer living in the neighborhood they were, maybe that's changed, and that has to be paid attention to as well. So that also then relates to their personal safety of their judgment calls. Are they aware that they're not taking showers anymore? Are they aware that they are choosing the wrong things to go out in? Are they aware that they're not wearing masks when they go out, right? We've all seen over the course of the pandemic, people walking around without masks. Now, depending on the part of the country you're in, it might be that nobody's really wearing masks and it wasn't noticed. But here, if you saw a lot of at least one of the times I was walking around, I saw 3 separate older adults walking around without masks and without jackets. And it was just a flash went off in my own head. If they're not remembering to put on their mask, they're not remembering to put on their jackets, something's going on. It happened to be, I knew those older adults, I was able to approach them or approach their family members, but we have to really see, where is that judgment? Has their judgment and cognition changed since the beginning of the pandemic? Being alone can do that. And I'll talk a little bit more about that on the next slide.
Speaking of which, we will move on to the next slide. Next slide, psychological. So again, one of the areas that you all were real concerned about, according to the poll, what are the protective factors associated with the psychological domain? So cognitive intactness, pretty much what it sounds like. Have there been any declines in cognitive functioning since you last saw your clients face to face? Having a sense of purpose and a sense of control. A sense of purpose is more, a reason to get up in the morning. What keeps me going? What do I need? What value do I feel my life has in the world? And how has that changed since I've been so cut off from so many things as a result of the pandemic? A sense of control, more about my sense of agency, my ability to make decisions and to carry out decisions about my life. Am I doing things because others are telling me to do them, or am I doing them because I have the ability to make choices and do it on my own? And how has that changed since the pandemic has been in play? And again, it may be if you have clients living in facilities or clients living with family members, the sense of control can be an important factor to be paying attention to. And then emotional stability, struggling with depression, struggling with anxiety, other kinds of mental health disorders. What kind of change has there been in that area since the pandemic?
Now, 3 out of 4 of these, we've all experienced. We've all had changes in our emotional stability. We've all had changes in our sense of purpose, and we've all had changes in our sense of control. The only thing that might set us apart from our older adults is the cognitive intactness. And knowing some younger people, I'm not even sure they were not affected by it. But let's talk about that one first. Cognitive intactness is absolutely affected, as all of these are, by isolation. And isolation was by far the largest concern of most people over the course of the year for older adults. Isolation is a killer. It leads to horrible things, one of which is cognitive decline. And many of us in the past may have used some of the measurement tools, the MoCA, the Mini Mental, whatever we could before. And yet many of us are still not seeing people in person. How do we do that? Either now before we go in or after we go in. So the MOCA itself, for those of you who have been certified by the MOCA test, mocatest.org, MOCA has changed over the years. It used to be totally free. It still is free. However, they now require you to be certified in giving it because it was widely spread during the previous presidential administration. And so they put a little more lockdown around it. And there is one that can be done by phone. There is one that can be done virtually. They have many different versions that they've adapted because of this global pandemic, and they are still reliable and valid. But let's say you can't go in there and they don't want to do it online. There is also the SAGE, which is a self-administered geriatric exam. And so you can put that in the mail with a self-addressed stamped envelope and say, fill this out for me and send it back. And most people will still be able to get out to the mailbox and mail it to you. And you'll be able to have it self-administered, again, still reliable, still valid. It's not the MOCA, but it's good enough. You may really need this to go against their baseline to see, have they changed? Have they changed? Now, do you absolutely need a screening tool to see if someone's cognitive intactness is different? No, you probably can gauge it by conversation with them, seeing if they have become more repetitive over the course of a year. I have a client, she since passed, but I had a client who I would refer to as being on a 6-minute loop. Every 6 minutes, I would have the same conversation with her. And it didn't matter what I said, she literally remembered none of it. Many of you have this experience. I have zero doubt about that. How many of our clients, have changed to a 6-minute loop client over the course of the year? So it's very, very important to measure, again, using the MOCA, the SAGE, the MMSE, whatever works for you. These are all reliable, valid instruments. I really highly recommend it. My favorite still is the MOCA. I'm not going to change. Sense of purpose. People lost it. We all lost it. We didn't even know what we had, right? We're all suddenly locked in our homes. We can't go outside. The most you can do is maybe take a walk. And even at the beginning, we were all afraid to do that. So people didn't have the outlets to do what they did before. Maybe you had hospital volunteers. Maybe you had hospice volunteers. Maybe you had people leading exercise classes. My parents now live in Florida, and they used to live in New York. They moved to Florida a couple of years ago, and there is an 85-year-old woman who leads the daily exercise class. I should be so healthy at 85 as this woman is. My parents should be as healthy, right? And she couldn't do it because everything there was locked down. And my mother would call her and say, how are you doing? And she's like, I feel like I have no purpose. And my mother would work with her and try to just talk to her, because my mother's actually a pretty upbeat person with that. And when things started opening up and everyone was getting vaccinated, this woman was the first woman out there having exercise classes literally in the middle of the street of their complex. Why? Because she needed that sense of purpose. So we have to ask our clients, what did you lose and how can we get it back? Helping them identify what it was that they lost in the first place will help you give them the building blocks to build it back better. Their sense of control, like all of us, was stolen away. No one had control, at least again, at the beginning of the pandemic. Everything was locked down, everything was taken away, and we all felt helpless. We all felt like we didn't know what to do. And yet, over the course of the year, many of us have been able to regain that agency and that control. But many of our older adults probably haven't, for a couple different reasons. One, they were really scarred more than we were, right? Maybe they're not as resilient as the rest of the population. We know older adults can be, but maybe they weren't. And so having lost that sense of control, they really feel they can't get it back. Some of them may have actually lost their sense of control to spouses or adult children or other family members who felt, well, you can't make those decisions on your own because you're going to make a misstep. How many adult children do we know who told their parents, no, you can't go meet your friends on the porch with your masks on 6 feet apart. You might still catch something. And how many older adults said, thanks, dear, and listened or didn't listen? So there may actually be a true loss of control to other people. And how do they feel about that? And how do we give them some agency if some of that control really won't be given back? How many conversations do we need to have with adult children and spouses to say, you know what, the pandemic's not what it was. can we let them make these decisions for themselves? We need to have those conversations. We need to be our clients' advocates in that way if they can't do it themselves. But if there's people who lost that sense of control, possibly due to cognitive changes, you have to work with them on at least not feeling that they have zero control, even if they haven't gotten all of it back or might not get all of it back. And then there's emotional stability. Again, you find me someone whose emotional stability came through totally intact, I want to meet that person. Because even people who have done well, and I have some staff members who, whoa, are they doing great? But everyone was affected at some point, everyone. And so normalizing, the first step is always normalizing the fact that they were not feeling great. We all felt bad. So by normalizing the fact that they may have been depressed or may still be depressed or may be anxious or have been anxious is important so they don't feel, oh, it's just me. Many of our older adults come from times where you could not talk about mental illness, right? You might have assessed their family history by saying, not that was your mother depressed or was your father anxious, but was your father high strung, right? We would ask that question because nobody would answer to the other one. So you have to normalize it, especially for the oldest of the old. And once you've normalized it, you have the ability to measure it, whether it's using the geriatric depression inventory, a PHQ-9, a Beck depression scale, any of the general anxiety scale, anything you can to help measure it in a way that's not scary to them, right? We like the geriatric depression screen because it forces them to say yes or no to questions having to taken place in the past couple of weeks. It forces them to really say, and how many of them then say, what can I say, maybe? And we say, no, give us a yes or no. And it forces them to think about their own symptoms and how they're truly feeling. So they become more insightful. So the screening tools, again, are very, very helpful, but so is the conversation you're having with them about how they're feeling. And ask them how they're feeling. And I'm not like, how you doing? Oh, I'm fine. How are you? Literally changing the emphasis on how are you will always elicit more than just fine. Asking them from the heart, not just a screening question, not just an assessment, but asking them from the heart, how are you? How have you been doing? Will go a long way to reestablishing a trust and a relationship and a rapport that you may not have been able to keep as strongly this year. And that's a big part of it. We have to reestablish that with our clients. Often we are the only thing that's standing between them and possible institutionalization. So they have to trust you. You want them to like you, but they have to be able to trust you in everything that you're doing. Testing that emotional stability, working on that relationship, it's precious.
Great. Thanks so much, Stefanie. Well, we'd like to turn it over to you all to hear what kinds of questions or thoughts or concerns you have while we have some time left. So I don't know if anything's in the chat or if people would like to unmute yourselves and just ask a question. We'd be happy to answer them.
If nobody asks a question, I'm going to be forced to tell more stories about my parents. And my father already says, you use me as examples all the time. Am I just a talking point to you? And I go, well, not just a talking point, but he's a very useful one.
Well, while people think about the questions they might have, I am going to just say a couple of words about the PFMIpro, what it is, how it works, how it incorporates the protective factors that we've been talking about throughout this whole presentation. The PFMIpro is an outcome assessment tool designed specifically for older adults. It's strongly based in the psychological research about the risk factors that are associated with the loss of independence. It's an assessment that's administered by professionals, by people like you. It can be done on a tablet. It can be done on a computer. It gives you real-time results, information, and it basically scores each one of those protective factors that we've been talking about. So it takes things like safety and security and psychological well-being, It assigns numerical values to each of those, the factors that make up those domains. And the value of the PFMIpro primarily is in monitoring changes in your clients over time. Why? Why is that so important? Well, we know that our clients are going to decline over time, as we all are going to. And we know that the faster the decline, the more problematic the situation that we're trying to assist our clients with. If we're able to slow the decline through our services, through our supports, then we're doing our jobs. We're doing our clients a service. And so the PFMIpro helps us measure how good a job we're doing at slowing decline by being able to objectively monitor each of those protective factors over time. This tool is being used by organizations around the country right now. We were able to train organizations to use the tool. It's used in conjunction with things like the Midi-Mental or the MOCA that Stephanie was referring to. But it's a very nice way for social workers, for service providers, and for organizations to monitor the well-being of their older adult clients. So that's the short version of what the PFMIpro is. If you have questions about the PFMIpro, if you would like to speak with someone about it, then you can reach out to Tucker at the email address listed on your screen. He'd be happy to speak with you about that. Okay, I see a question here in the chat. Yep. Are there any specific activities that you would suggest bringing back early on when things start to get reopened to help folks get acclimated to group activities again?
You know, that's a good question, Megan. That's a good question. I would say two of them pop into mind first. One is an outdoor exercise class, like a sit and be fit kind of thing, or a stretching thing, where, well, since the weather is nicer now, or hopefully nicer where you are, right, you can spread things out in an outdoor space where people can come still masked or not masked, because if many of them will be vaccinated. And you're now bringing people together, but far enough apart, with a set activity, right? Because if you just say, hey, come and chat with your friends, people may not necessarily go. People like a purpose. So that's one of them. The other is getting together ostensibly to do something. Maybe it's to do a packing of some sort, maybe packing food for a food pantry, or doing a craft for a homeless shelter, something that involves a purpose, but is really to bring people together, again, socially distant, maybe outside or inside, socially distant with masks. But by bringing them together with that purpose, they'll automatically start talking to each other because they haven't seen each other, and they'll be very excited, right? I know we've been working remotely. We're actually still remotely, although we come into the office here and there. I happen to be in the office today. And I remember the first time I walked into the office and I ran into someone in real life, I almost had a heart attack and threw a party at the same time. So a lot of these older adults are kind of experiencing that push and pull. So, but if you give them a purpose, the socialization will naturally kind of fall from there. So that would be my recommendation. We do have a second question. Will your slides be available to the participants?
Yes.
Yes, the answer is yes.
We will send the slides immediately after the presentation. And we also recorded the presentation. So you all have it in case you'd like to share this with any of your colleagues.
I'm actually going to be putting my email address in the chat as well. So if anybody has any follow-up questions they'd like, please feel free to reach out to me. I'm happy to chat with you.
So with that, if Tucker will be in touch following this call, in case you would like to schedule a one-on-one consultation to discuss specific challenges and discuss what workflow, what programs you have in your organization, and answer any questions you might have if you don't feel comfortable asking in this setting. Otherwise, we'll send the presentation as well as a recording of the presentation for you to enjoy. And thank you all for joining us. We're really grateful for your attendance and participation.
Thanks, everyone.